Shifting focus for now. Our next story begins with a critical question. Why is China silent on the new virus outbreak in the country? 5 years after the Wuhan virus brought the world to a standstill, a new mystery virus outbreak has sparked concern about another epidemic emerging from China. Beijing's silence, in a way, is not helping the situation. China is reportedly witnessing a rise in respiratory illnesses, including human metapneumovirus, also known as HMPV. What is HMPV? It's a respiratory illness that can infect people of all ages. It's the most common in children, raising further public health concern. As for what the symptoms are, the symptoms reportedly include cough, fever, runny or stuffy nose, sore throat, wheezing, shortness of breath, and rash. HMPV transmits through direct contact with someone who has it or from touching things contaminated with the virus. In other words, the virus can spread by coughing and sneezing, shaking hands, hugging or kissing, touching surfaces or objects like phones, door handles, keyboards, toys. Which brings us to the question of who is at risk from the virus. Children under the age of 5, immunocompromised populations, and the elderly. Now, these groups are more susceptible and more likely to be co-infected with other respiratory viruses. In susceptible individuals with underlying medical conditions, HMPV infection can lead to death. Based on data from an article published in Lancet Global Health in 2021, 1% of acute lower respiratory infection-related deaths in children under age 5 can be attributed to HMPV. In fact, health experts have expressed concern about the spread of the virus reportedly. China's health authorities say that the virus is spreading across the northern regions of the country. The Chinese Center for Disease Control and Prevention reportedly has confirmed that northern China is the worst affected. Areas surrounding China are reportedly implementing strict monitoring measures. Hong Kong, for example, has reported very few cases. According to South African Broadcasting Corporation, SABC News, Japan's health authorities are actively monitoring the issue. It's because following a significant influenza outbreak, Japan reported thousands of cases nationwide. According to Japan Broadcasting Corporation, over 94,000 flu patients were reported in 1 week leading up to December 15, and that is across 5,000 hospitals and clinics throughout the country. The total number of cases in Japan for the current season has now reached 718,000 reportedly. As for India, it is reportedly monitoring the situation and is also in touch with international agencies. The National Center for Disease Control, NCDC, is closely monitoring respiratory infections and seasonal influenza cases. The outbreak has heightened awareness about the need for preventive measures, especially since no vaccine exists for HMPV. And this is despite the fact that the virus was first detected nearly 2 decades ago. Currently, there is no vaccine or effective medication against HMPV, and treatment is mostly focused on alleviating symptoms. And that is why health experts are urging vigilance and adherence to public health guidelines to limit the spread of the virus. The common people have been advised by the authorities to wash their hands, wear masks, other precautions. Remember, your health comes first. Authorities are monitoring the situation closely. It's always safe to exercise precaution, they say. And they also say, here's what else can be done. As per experts, wash your hands often with soap, cover your nose or mouth while sneezing or coughing, wear a mask if you're sick, and avoid being around others, avoid touching your face, eyes, nose, mouth, unless your hands are clean. Ultimately, they say it all boils down to the little habits. To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.